Good evening, everyone. I'm AnnMarie Cronin, and I'll be hosting a special live broadcast tonight on 760 WJR. We're going to be talking about the prevention of disease and the urgency of taking action before the onset of serious medical problems. Dr. Brian Kolender, MD, internal medicine physician and specialist in prevention, is here tonight to talk about how to avoid heart attack and stroke altogether and what you need to do to prevent Alzheimer's and many other chronic diseases. If you have a question, we're opening up the lines and taking your calls. So make a note of this number, 800-859-0957. We'll be repeating it throughout the show, and this is your opportunity to talk directly to the doctor. So stay tuned, and we'll be right back. You're listening to 760 WJR.
Okay, so we should be on Facebook Live now?
Yes, we should
We
be.
are.
Yeah.
Okay, here we go.
There we
Facebook
go.
Live.
I
So
think
what's the
that-
topic for today?
Well, apparently, I shouldn't say apparently, heart attacks go up at the end of the year during the holidays for all kinds of reasons. So I thought we'd let the listeners know they should be careful about taking care of themselves during the holidays. And there's a lot of reasons that their normal routines might get overturned, which might lead them to be at higher risk. So this is just how to not have a heart attack in the next 3 weeks, which is a good, no one wants their Christmas to be marred by a death.
What causes it? What do you think the reason is? What's the surge caused by?
Well, we got to put this on the show, shouldn't we? This is a teaser.
Yeah, definitely. And we
this
also
is
have
a
a
teaser.
caller.
You've got a caller.
Right.
Who's
This
the
is
caller?
called a teaser. They have to listen to the show to kind of get the
Well, I think the
ideas.
Facebook people stick with us throughout the whole thing.
Well, they still got to wait for the show. I don't want to repeat myself. I got to keep myself interested.
Interesting.
So, right.
I think he meant interested.
Yes.
That's really bad, underlining what he said.
Right.
Yeah.
So it's, we've just, I think we'll hopefully give some gifts to the audience, to the listeners. I don't mean like gifts, but educational nuggets about what to do, because people take their health for granted all the time. And here's a chance, let's just avoid some things that are common that people may do at the end of the year for whatever reason, so they get through safe and healthy.
All right, Siobhan, you're in charge of promoting Facebook. Again, I'd like to welcome all of you to a special medical show here on 760 WJR. I'm AnnMarie Cronin, and we're here tonight to talk to you about prevention and why you have to start looking at healthcare from a different perspective. Dr. Brian Kolender, MD, is joining us from Birmingham, Michigan, to give us some hard talk about dealing with our health and making sure we get the necessary testing. We're inviting you to call in and talk to the doctor directly if you have a question at 800-859-0957. Again, that's 800-859-0957. Dr. Kolender, welcome back. Your shows are always full of information and things the listening audience has no clue about. What's your advice for this season and for tonight and going forward?
Well, first of all, holiday season's upon us. So, I don't know what the show schedule is moving forward, to be honest. So let's just wish everyone.
We'll always be here on Thursday.
Right. So let's take this time to wish everybody happy, healthy holiday, Merry Christmas, Hanukkah's coming, New Year's.
Right.
And I think the listeners need to know that.
How do they stay well? That's what we want to know. We want to be alive to the new year. How about that?
Right. So heart attack deaths actually go up during the holidays. So, let's talk about how to not make that happen. And, why does it happen? And, strangely enough, probably the number one reason people get into health issues is non-compliance with their medicine. And that's actually the number one reason for hospital admissions and hospital readmissions is people don't follow the directions of their doctors. And I think there's a lot of reasons for that. Number one is when you only have a couple minutes to spend with your doctor and you're getting this deluge of information, they may not even talk about the drugs they're prescribing. And
They don't even talk about the tests that you're getting.
Well,
or why you need them.
in 5 minutes, all you get is referrals and prescriptions.
Right.
And so, after the visit, a couple days later, the patient goes to the pharmacist and they get their prescriptions, and no one knows what any drug is for. And if you don't know why you're taking something, you're less likely to follow through. I think that's just true of anything. If you don't really understand the reason for doing something, you're less likely to do it, whether it's any life altering activity or, even at work. If you don't know why you're being told to do something, you're probably not likely to follow through on it. So if you don't know why you're taking any specific drug, then you may not take it. Another reason, or it gets fallen off, or of course, then there's also double dosing. So the reason double dosing occurs is if you use mail order pharmacies and you're on automatic refill, you may miss some days, or the mail order pharmacy may substitute your drug for a different generic brand, and you end up taking 2 of the same drug, not recognizing that you have 2 of the same drug. And it's not the patient's fault. The pill's got a slightly different name. It's from a different manufacturer. It looks different. It might be a different color, even though it's the same drug. So that's, one reason, non-compliance with medicine is a big problem.
How do we solve it? That's the question.
Well, there's a lot of other things we have to talk about that are reasons for people who are having issues, I think, before we get to that.
Let's take Siobhan's got calls backing up here. Who's calling, Siobhan?
Yes, we have Greg from Shelby on the line. Greg, what's your question?
Hey, good evening, you guys. Mr. Positive. Always love this show, Dr. Kolender and the All-Star crew. Hey, real quick, it seems like you've been very prescient about the vaccine. Pfizer and Moderna are saying that it was on a Guy Gordon show today a little bit about maybe people who got the shot shouldn't have got the shot, people who didn't necessarily need the shot. And you were so prescient, my friend. What say you about what's coming out about these vaccines? And fill us in and give us more education about what has been bandied about. And
I just, before you answer,
nerve-wracking.
I just want to jump in here. Guy Gordon was talking about it today, about the fact that he was giving information on shots that we got 2 years ago. And he wants us,
in the sense that, that he alluded to, or they talked to a gentleman who alluded to that maybe certain ages should have been the only ones that taken it. It would maybe mandated who took what, when, and where. Maybe it's just something that just came out today, and it was quite eye-opening. Going, wow.
Well, did they talk about? Did they mention which specific vaccines? Was it Pfizer, Moderna, Johnson & Johnson? Did they talk about?
No, Pfizer and Moderna were the 2 names that were brought up, and I was just wondering if Dr. Kolender heard about it, and just was very curious because it was quite eye-opening, and it made me like, whoa. And it's very prescient on Dr. Kolender's, because he's always been a little bit, let's look into this more, and that's what makes him such a great doctor.
Well, what was the outcome? What did Guy say? What was the outcome at the end of the show? I didn't listen to it.
And AnnMarie, it was I caught bits and pieces, but that was the most germane. That was the most salient point about everybody getting it. Maybe some didn't need it, but you got to side on caution. But here we go again. Do we actually really know exactly what this is going to do to us down the road? With all the different variations. And someone just brought up recently that the vaccine, maybe there's components in there that might be able to cure or offset skin cancer.
Greg,
we're going to have to come back and talk about this more on the other side of the break. Again, you're listening to our weekly live medical radio show where we keep you up to date on all medical solutions, from dealing with COVID to avoiding catastrophic disease. We're here tonight with Dr. Brian Kolender, MD, talking about prevention. If you have a specific question and you would like to talk to the doctor directly about what you ought to be doing to prevent or reverse chronic disease, please call us at 800-859-0957. You're listening to 760 WJR.
How'd that segment go?
It went well with me answering it. I think it went really well with me usurping your answer.
No, I was not going to jump on that. And that was as sarcastic as I can be on the public.
Well, the whole, I mean, it's really kind of unfortunate because I didn't listen to the show, so I don't know what the point of the show was or what was discussed or what he said, but
we're not going to say anything. I'm just the world is catching up to the things that we've been saying all along. That's all that's happening. And that's really it. So we're not going to, and unfortunately, we're not going to talk about COVID anymore because we have more important things to say in the future. And we want to build up our YouTube time and Facebook time and not get canceled talking about things that, in my opinion, are fairly irrelevant moving forward.
Right. Well, I mean, and also, what crossed my mind is Greg, and he always comes up with great questions to ask, there's no doubt about it. But one of the things that just crossed my mind is this is 2 years ago when we all marched in and got the Pfizer, Moderna, Johnson & Johnson, because people just didn't want to. I mean, the news of the day at the time was everybody was dying in the hospital. The hospitals were all full. Everybody was intubated. They were all dying. So people figured, listen, it's better to take a shot regardless of do we know the efficacy of the shot than. And then we were forced to because you couldn't go to certain places to work. You couldn't fly. We had to go to Costa Rica. We had to get shots to go to Costa Rica. I mean, there were all kinds of limitations on, if you wanted to stay at home. But there were certainly a lot of businesses that didn't allow you to work unless you took the shot. So, but, it was 2 years ago. So, I mean, my question to you is, moving down the line now, I mean, I'll listen to the show later on today or tomorrow, but I mean, moving down the line, I'm thinking to myself, are the pharmaceutical companies that produce these injections, these vaccines, these shots, are they following up on the outcome? Are there studies going on, Moderna and Pfizer and those vaccines and looking at, there has to be, they're pharmaceutical companies.
Well, we're not allowed to talk about studies that don't promote the vaccine. So we're not going to talk about them, right?
No, but I mean, I'm just saying.
And we do have another caller, by the way, not to change the subject.
No, but I'm sure the point is
Why don't we go to the
address
caller? No.
But we're not
going
to.
This is a dead end. It was a dead end on the moment it came up.
Right.
Okay.
So
you're in charge now, Siobhan.
All right.
You're in charge now, Siobhan. Welcome back to our special live medical broadcast on 760 WJR. We're fortunate to have Dr. Brian Kolender, MD, internal medicine physician and specialist in prevention, here with us tonight to give us some straight talk about two important topics, prevention and being proactive. So please tune into our weekly shows, Sunday afternoon at 3 p.m. and live Thursday at 7. We're inviting you right now to call in with your questions and talk directly to the doctor at 800-859-0957. Dr. Kolender, we're coming back after break, so
we have a call.
We have a caller.
Yeah, let's jump to the caller. We have Scott from Dearborn on the line. Scott, what's your question?
Yeah, hi. I called in last week about my wife that passed away from stage 4 cervical cancer, and what's the name for Shelby? That
Greg
called in about yes, and ironically, I called in right after him the last time. Also, it's kind of ironic that we're talking with each other, but I heard the same thing too on Guy Gordon's show too. He had a doctor on, and I can't remember his name, but he said the same thing about what Greg was talking about.
Well, let me.
You guys find out any information about that?
Well, let me jump in because neither of us listen to the show, AnnMarie nor I. So, all I'm going to say about COVID is that, I think a lot of the things that we talked about for the last year and a half are getting caught up to in more of the lay press and the mainstream media to some degree. And we're not going to talk a lot about COVID. And I know you all have questions. And the reason is we do have bigger fish to fry down the road, and we're looking forward instead of looking back. And so, if you want to read between the lines, I don't really think of COVID as anything that we need to do anything about any further, unless there's a change to it. So if you hear what I'm saying, we're really going to talk about prevention, because COVID to me is in the past. And whatever happened, and whoever made mistakes and did things they shouldn't do, hopefully they will, pay the price that they've, for whatever it is they've done or not done to help people.
Well, moving on from the COVID discussion, which could take a whole show, we're going to come back and talk about what we started off talking about, which is at this time of the year, we see an increase in heart attack and incidents. And first of all, why is that?
Well, there's a lot of reasons, and stress is another one of them. So, one of the things we don't talk a lot about on the show is lifestyle. And so this, I'm going to say, is our lifestyle prevention show. And the main tenets of prevention are the foundation of prevention is lifestyle. And the main tenets of that are healthy eating, regular exercise, and manage your stress. And getting the family together can be very, very stressful for everybody. And, we talk about self-care. We've had many shows about your mental health and making sure that you're in a position to take care of yourself, not getting in your own way. And so being in the midst of all your family members who've been triggering you your whole life, with stressors, is really hard on some people. So recognizing that you're walking into a very stressful situation can trigger an event. So high stress raises your blood pressure, high stress impairs your sleep, and people may generate some negative habits during stressful times. They may stop exercising, they might drink more alcohol, they may make bad food choices, and all of these contribute to cardiovascular events because your internal environment generate, if there's a lot of inflammation that you're adding to it, inflammation is what triggers vascular events. So we want to continue our good habits, and we'll talk about what some of those things should be. But number one is, stay on your medicines, and because people are non-compliant, they don't take the prescriptions that were prescribed to them.
Why do you think that is?
It's human nature that people forget. They don't want
They
to take a
forget,
pill.
or there's resistance. Resistance
Well,
is one thing.
I mean, I'm not good at taking my pills, I'll be honest. I mean, I take a statin and I'm not good at it.
You get sick, you can help yourself. They can't.
Well, no, a lot of doctors drop dead. And I mean, I'm more aware of where my health is because I do all the tests that I'm telling
Right.
you all to do. So I've known that I've improved my vascular health. But I go, I'm a human being too, and I forget to take my pills. And so it's you've just got to remember, and this is why we're on the show, is remember to take your pills, especially your blood pressure pills, your cholesterol statin pills. Make sure you're taking your diabetic pills, and that will help. And hopefully you're on the right diabetic pills and the right blood pressure pills that will reduce vascular inflammation and prevent vascular events like heart attack and stroke.
Well, let me ask you, what are some of the repercussions? Let's say you miss a day, because I am also taking a statin. What are some of the repercussions if you miss a day or two? Is this like serious, or is it more about missing long periods of time?
I think it depends on your risk. So it's you can't make a summary judgment about that. It depends on the risk. So, if you're a high risk person, of course, most listeners don't know if they're high risk or not. But there are patients I have that come in, they're new, they're still just getting into the system. They haven't, they might walk in high risk. And if they tell me, holidays are coming, I might tell them, take extra of your diabetes pills, take extra of your statins, and those, if they're on the right diabetic pills and statins, those reduce inflammation. And so it's never a bad thing to take an extra statin. There's no harm there. And depending on the diabetic pill, again, depends on the pill, so I can't tell you which one it might be. It may not be that bad to take an extra diabetic pill, especially if it's one that doesn't lower your blood sugar. And there are diabetic pills that do not cause low hypoglycemia or low blood sugar. So those things are not bad to do. And if you're going to sit down and have a massive amount of food, for Christmas, then maybe taking extra statin's not the end of the world. It might protect you because you don't want to have to think about someone dying, memorializing a death every Christmas.
Scary thought. But again, I mean, you've talked a lot about people taking their pills and taking their medication. And once again, the whole show is all about prevention. So what do the people that haven't been diagnosed need to know?
Well, I mean, these are just other things. And some of the other pitfalls are, especially for Medicare patients, they might still be in the donut hole, where their insurance from Medicare Part D is waned off and they're not able to get their medications. It's more out-of-pocket spending and they can't get to them. So these are other, financial reasons that people may not get to their medication. They might be choosing to buy some gifts instead of paying their copay for prescriptions. And so, it's a lot of unforeseen pitfalls that can keep people from doing what their doctor wants them to do. And again, what your doctor wants you to do and what you've heard your doctor tell you are two different things. Because your doctor, again, is not educating you about why you're taking pills. You don't even know how many pills they ordered. And
Right.
you go to the pharmacy to get your batch of pills. You have no idea if you got all of them or it's the wrong ones or if it's the right dose or not, because that's not being given to you on the front end.
It's just blind following, isn't it? It's like the doctor gives you a prescription, you go and fill the prescription, and you're taking these pills ad infinitum, not knowing what's in them, what the I mean, very few people probably look up what the side effects are. But once again, I really always want to come back to the fact that you shouldn't be taking pharma in the first place.
Well, that's not true.
If you're all, but let's go back a little bit farther. Just let's try to avoid the disease. Let's talk about that on the other side of the break. Again, you're listening to a special live medical broadcast on the prevention and medical management of disease. If you have a specific question and you would like to talk to the doctor directly about what you need to do to avoid heart attack and stroke, or you have a question on any of the subjects we're discussing tonight, please give us a call at 800-859-0957. You're listening to 760 WJR. Next segment is segment 4.
Back on Facebook. Yep.
Yeah, it's going very fast.
Yeah, it is.
So, I mean, you can't tell people they can't take drugs. You don't know
I didn't
what
say that. What I'm saying is they shouldn't get to the point of needing them. Because if we're talking about the dichotomy in the message here, if you're talking about, and I believe what you're saying, and I fully believe in what your practice does, is you are there, you started this practice, you're one of the leaders in the country in doing it. It's like, it's all about, let's not get the disease in the first place. Let's not get diabetes. Let's not have a heart attack.
Sometimes the pharma is part of the management. Like, for example, I'm, I eat healthy and I exercise, but I need to be on a statin because of my
Understood,
my CIMT
but you had to first of all get the CIMT. Otherwise, you'd be like out in left field thinking, I'm good.
With the proper information, of course. You shouldn't be just like blindly taking whatever.
Right.
But it's a balance of having the right information and the right guidance, and that's the key, really.
Let's give a few other lifestyle tidbits before we move into the full-blown prevention show.
Okay.
And actually, this could also be we never really talked about recognizing insulin resistance for non-patients. We did that a few times on the Sunday show. We haven't done that on the live show, so we should do that.
Yeah, I mean,
put some time into that. Just let people know that they can self-diagnose with themselves with insulin resistance because they're not going to hear about it from their doctor.
They don't even know what that is.
Well, I mean, we've done whole shows on it, so we'll have to.
You have to explain how you recognize insulin resistance. recognizing it is one thing, and, how do you recognize it? But I mean, like in your case, Siobhan, I mean, you're just one of the fortunate few that jumped on the bandwagon of prevention and got the diagnostic test. Otherwise, you're a typical example of the person who thinks, "Oh, I'm thin, I run, I exercise every day, I eat right, I'm vegan, I check all the boxes of great health." Doesn't mean anything.
Yeah, absolutely. Well, it takes
So
some deeper digging. I did a sleep test, so I have to get the results from that and, just figure out what is the source of the problem.
no, but see, once you jumped in the deep end and decided I'm gonna go through this journey of going through what I need to do to be guaranteed that there's nothing wrong, then you start to find out exactly what was wrong. And this happens you see it all the time because you're young and, skinny and run doesn't mean that you're safe from disease.
You got to screen. You cannot make
Right.
assumptions. You've
Can't
got to
make
screen.
assumptions about your health, no matter what age you are, no matter where you are, and no matter how much you think that you eat well and live well. And, there's still no guarantees.
No, you gotta know. You gotta look.
It's like, not to bring up, a past employee of yours, but hey, one of the youngest, healthiest looking girls that ever worked for you had the worst results when she went through getting all the testing
Right.
done. She had like arteries of what, a 50-year-old or something.
At 22.
At 22 years old. Can you imagine? And just imagine, I mean, she would never have sought out that type of medical diagnostic work. She would never have gone on her own because she's probably sitting thinking, I look good, I run, I'm healthy, I eat well, I exercise.
Well, she didn't eat well, but
I didn't
she
know
was
that. I
thin.
thought that she did.
Not really. And when you're thin and don't put weight on, I guess
Yeah.
we're out.
I think also too, a lot of people affiliate heart disease with men. I think women don't really look into that as much.
Oh, we're back now. Wow. Welcome back to our special live weekly medical show here on 760 WJR. We are back again with Dr. Brian Kolender, MD, internal medicine physician in Birmingham, Michigan. As a recognized leader in the field of catastrophic disease prevention, including heart attack, stroke, diabetes, and many chronic conditions, he's here tonight to give us some hard advice on what we need to do to avoid heart attack and stroke altogether. Through advanced and more sophisticated diagnostic technology, we're now able to arrest and reverse the progress of these silent killers. We're inviting you to call in with your questions at 800-859-0957. So, Dr. Kolender, let's come back and talk some more about the whole aspect of what they need to do ahead of time, what prevention is all about.
Well, we're trying to keep everyone from having a heart attack while they are celebrating Christmas and New Year's.
Right.
And, I think another thing for people who take high blood pressure medications is you really got to keep your salt intake down. And I wouldn't say that, year round, but what happens is, everyone says, well, I'm taking off this week. Like I'm going to be
Right.
whatever my habits are this week, they're out the window. And I'm going to do whatever I want because it's Christmas and New Year's and I got bowl games. And all that food is not healthy. There's too much fat, there's too much sugar, there's too much salt. And if you're on a blood pressure pill, you're at risk of putting yourself into fluid overload because the salt draws more fluid into you and you go into volume overload. And we don't want to end up in the hospital with heart failure or a stroke. And not everybody has symptoms from high blood pressure. So things to look out for. Don't assume just because you're on a pill that you're safe, because your lifestyle is the foundation for treatment, not the pill.
Okay, Siobhan, I'm going to have Ashley take this next question because you're getting back top, Ashley.
We have Tony calling from Wayne. Tony, what's your question?
Yes, this is in regards to taking statin drugs. I heard one of the side effects is loss of memory.
Well, there are a lot of negative side effects listed for statins, and I have had patients have memory loss on a statin. We had to stop it. That does not mean that the general population should not consider a statin if you have plaque. So the difference between what I do and what the general doctors are doing is I don't use like your cholesterol number as a gauge for whether or not you should be on a statin. I put people on statin that have plaque, which is the disease that you're treating. and then we follow specific data points that measure
you
your risk based on, and it guides our statin therapy. So for people that need statins, if we have a side effect, we either lower the dose or take a break or try a different statin, because not every statin causes that problem in every person. So in particular, one patient I'm having in mind right now who had major memory issues after one statin, he stopped it, took a break, and he's doing really well on a different statin. So it's you can't make those broad statements.
Okay, Siobhan, we're getting back top. Who's your next caller?
Sure. Up next, we have David in Windsor. David, what's your question?
We're not hearing
Yeah,
her. Oh, it's David. Hi,
Yeah.
David.
Yeah,
I
we have David.
recognize his
Hi,
voice.
David. What's your
Yes.
question?
Yes, my question for Dr. Kolender, which is kind of off topic here, but this comes to mind as well. What about the areas in your clinic or whatever you call it, have people working with different eye ailments like glaucoma and cataracts and people like that, and various different forms of different vision impairments? Because some people are born blind for different reasons, such as tumors, anything like that, or even a blow to the head that receives a bump that had in the past and has lost their vision through that. Are you familiar with those areas of vision impairment?
Well,
Because
thanks
there
for
are so many different degrees of
yeah.
that.
Well, thanks for calling, and I'm going to kind of answer your question a little differently. So, I mean, I'm not an ophthalmologist, so I'm not an expert in vision issues. So, but what I would like people to recognize is that if they have a vision issue that involves either a retinal artery, or possibly even a retinal vein, then that is a representation of a vascular injury, which could have other systemic problems. So, a lot of the conditions that you mentioned, David, I would say are things that I refer to specialists because it's not my area of expertise. And, and even being a primary care doctor, that's why we have ophthalmologists. But even if you see an ophthalmologist and you've got an artery issue, there isn't always the connection that this is a systemic problem and needs to be addressed as a whole body issue. And if you've got that artery issue, you could have an artery issue anywhere in your body and needs to be addressed.
Okay, Siobhan, you have another caller there? Are you plugged into us over there?
Ashley
Okay.
can take this one.
Okay, Ashley, go ahead.
Okay, we have Wendy calling from Detroit. Wendy, what's your question?
Hi, Dr. Kolender. I'm calling to ask, I have a daughter that is 34 years old, and she's been prescribed blood pressure medicine and a statin, and she has neither high cholesterol or blood pressure, but they've said she's diabetic recently, and the reason was to ward off the cholesterol issues and blood pressure. Have you ever heard of such a thing?
Yeah, actually, I have. And so people that are diabetic are at much increased risk of cardiovascular events than people that are not. So people that are diabetic are treated as if they have plaque and are prescribed statins. And the blood pressure pills are really not necessarily for blood pressure, but because diabetics on specific blood pressure pills can see fewer problems like kidney damage and eye damage. You hear about retinal issues and blindness, and there are blood pressure pills that stop that from happening in diabetics. So the real issue for your daughter is now that she's maybe a high risk person, she needs to have the right kind of data to identify her risk. And so right now, the traditional system is going to tell her that if she's on a statin and her A1C is at a good place and she's on these pills, she's done. And unfortunately, none of that is true. She needs to get the CIMT ultrasound that we do in our office that measures cardiovascular risk by looking at the layers of your artery wall. She needs labs that measure artery inflammation markers. And also she needs labs that take a better look at insulin resistance. And actually other people in the family need to be evaluated for diabetes because she's young and she has adult onset diabetes, which can take years to develop. So, and it's also runs in the family. So it's important to make sure and even you. So if it's, even though you've not been diagnosed with diabetes, you may be on the path to diabetes and not know it. And we'll probably talk about that next segment, how to recognize that you're on the path to diabetes without knowing or having your doctor tell you, because they're not going to recognize it. And the reason to know that and why that's important is because becoming diabetic is just as bad as being diabetic to your body, except you're not going to be treated unless you become diabetic. And there are people who are on the path. They're in this inflammatory state, which is going to generate risk. And we want to recognize all of these conditions that predispose people to chronic illness and death.
So I'm going to jump in here because Wendy's calling about her daughter, the concern that she has for her daughter being put on blood pressure medication and a statin. And I'm understanding that what you're saying is her daughter has been, is missing certain diagnostic tests that are going to tell her a lot more about what she needs to know about why she's being put. And in other words, more about, a fuller diagnosis.
Well, we're at the end of the segment, so we're going to have to come back to this. But right now in the traditional system, if you get labeled as a diabetic, it's like a package deal. You get a statin and a blood pressure pill that protects your vision and your kidneys from the onslaught and damage from diabetes. But that's not enough. You need to know.
There's more to the picture.
There's more to the picture that we need to go through, and we will.
All right. In the meantime, we've got to take a quick break again. You're listening to a special live medical broadcast on the prevention and medical management of disease. If you have a specific question and you'd like to talk to the doctor directly about what you need to do to avoid heart attack and stroke, or you have a question on any of the topics we're discussing tonight, please give us a call at 800-859-0957. Again, that's 800-859-0957. You're listening to 760 WJR.
Okay, back on Facebook.
Back on Facebook. But before we get started on, here's what I think. I mean, you need to come back and tell her that she needs to send her daughter into.
I did.
No, needs to dial 1-800 and send.
Well, you do that. I can't.
No, because
sell my show practice.
No, but I mean, I'm just saying.
Well, you start that, and I'll come in back and get.
Because I think it's a shame that they're handing out these, blood pressure pills and statin pills to people, and they're not looking at all the other things they need to look at. They're not doing a fully diagnostic dig into this patient's health.
Agree.
Well, that's wrong. I mean, it's not that I agree or you agree.
It's
like a cookie cutter resolution to a quick fix.
We'll get into it. I think.
Well, they're just putting a stamp on it.
Yeah.
It's like the filtered diagnosis, and then it's like, here's the package deal you get with it.
And that doctor's probably pretty proud of themselves and for doing what they did for Wendy's daughter. And they've
what did they do? Wait a minute. What did they do?
Well, they checked all the boxes that they were supposed to check.
They checked all the boxes they had available to check. That's not all the boxes that there are out there.
And they were the wrong boxes.
And they were so how is that good at all?
Well,
that's pathetic. No, wait a minute. Call a spade a spade. That's pathetic. Yes, pathetic. Begins with a P.
Let's.
We pay a lot of money in this country for health care. And what do we get? Chump change, like it's all right. You got half the picture here. Let's live on half the picture.
They need to know the real data that identifies their risk. And
I agree. I agree.
All right. Well, let's come back to that for sure.
It's just, it's just kind of a shame because they're going out there and seeing doctors. They're getting handed prescriptions, and maybe it's sort of, solving a partial problem, but it's not looking at the bigger picture.
Well, to them it is. I mean,
to who's them?
The doctor. The doctor thinks they did all the right things, and they don't know that there's way more better data to measure this person's risk. And I've got diabetics that don't have plaque, believe it or not, and they don't need to be on the statin, even though it's part of the cookie cutter answer.
We're going into the final segment.
Yeah, we are.
Well, we don't have a whole lot of time to talk about this.
No, we do not. Can you regenerate this anger?
Regenerate?
Yeah, can you?
I'm not. No, but I mean, it's just kind of. It's just, what do you want me to do? Like,
just conjure that whole angry
just
AnnMarie
do
up
what
again
do
for
what?
the live for the show, because I mean the Facebook audience got it, but I think the
No,
radio
because it just
people.
was annoying me listening to this. I mean, it's like, oh, hi, here's your, box of candy to go out the door with. I checked 2 boxes, you got 2 pills, have a nice life.
Right.
Because once you start taking blood pressure medication, you are going to be on it forever.
Not necessarily.
Mostly.
It's not necessary, but it is hard to get off of it, but it's not impossible.
That's very a hopeful speech that you just gave. Not
Well, but it's true. It's hard to get off because once you've been labeled with blood pressure, the way to
how many seconds?
the way to get off of it is to you got to work hard to get it off. It's
But
possible.
people don't even know how to get off. Okay?
No, I know that.
That's the point, and their doctors not caring about them
they
because
need better education.
Who? The doctors? Let's send them back to medical school. Right? I didn't hear you agreeing with me. Good luck with what?
Re-educating doctors.
Welcome back to our final segment of our special weekly live broadcast here on News Talk 760 WJR on the importance of being proactive and informed of the resources available to prevent and treat chronic and debilitating disease. You're listening to the expert advice of Dr. Brian Kolender, MD, internal medicine physician, and one of the very few specialists in prevention in this country. If you have a question for the doctor, now is your chance to call us at 800-859-0957. Again, that's 800-859-0957. Dr. Kolender, before I come back to the last inquiry, the last mother of a patient who called in, her daughter was put on blood pressure medication and a statin. We argued about this over the break on Facebook. And Siobhan, you need to be telling everybody to listen to Facebook, checking into Facebook Live.
Definitely. I mean, everybody that's listening live on the air, we do continue the conversation over the break. So go to the WJR Facebook page where we talk entirely throughout the break and continue all the content there.
And also, I'm just listening to my own words as I'm reading my script here, being informed of the resources available to prevent and treat chronic and debilitating disease. But Dr. Kolender, these doctors, these patients are not letting them know about what is out there, what the resources are that are available to prevent and treat chronic and debilitating disease.
Well, there's a lot to talk about Wendy's daughter here. And one of the most important things is, why did she wait till she became diabetic to be told that she's got a sugar problem?
What do you mean, why did she wait? How is she supposed to know?
Why did the doctor not recognize that?
You mean her PCP? Is that what you're talking about, her PCP?
Right. And so even at 34, she's probably been pre-diabetic or having insulin resistance, which is the process of becoming diabetic, for years. And
but that is not a diagnosable thing, right? I mean, that's the problem, is that we don't talk about that until you are already diabetic.
Correct. And so prevention requires an early disease identification, the earliest possible opportunity to identify disease. So even at 34, Wendy's daughter her body's been soaking in a quagmire of insulin and blood sugar. And that is a pre-diabetic, insulin resistant state that generates a massive amount of inflammation. So she's missed years, when I mean years, 15 to 20 years of opportunity to identify her as being insulin resistant, which is a driver of chronic disease like heart attack, stroke, Parkinson's, cancer, dementia.
Whose fault is that?
It's the doctors, because they did not make the effort to learn how to identify people at risk.
So to all the listening audience, because this is a really pathetic story. I mean, we argued about this over the break on Facebook, and it's just, infuriating to know that all of a sudden a 34-year-old shows up and she's now being told that she's pre-diabetic, you're on blood pressure and statin, and we know that those are, as you said over the break, they're hard to get off once you're on it. But the question that I have, and we don't know what the real answer is, but whether or not this patient went to see a PCP on a regular basis, it was not found, it was not diagnosed, because they're not talking about, explaining, and recommending the necessary testing to avoid these diseases. and it's like a call to action. Why are these doctors not doing it?
They have not made the effort to take better care of their patients.
Why not?
And
what's the Hippocratic Oath all about? Why not?
well, we said this during COVID, and we are saying it now, is that doctors that do not make the effort to understand opportunities in prevention and avail themselves of the tools which are readily available and inexpensive to identify early disease and put a stop to it, it's their fault. And I hate to say it, that if your doctor works for a company or works for a hospital, then they're baked into a system that is not designed for you to prevent disease. And when you go to the doctor and you're told you're okay, none of that information is helpful. And again, we don't know when Wendy's daughter went to the doctor before being diagnosed with diabetes, but let's just assume she went a year ago.
Mm-hmm.
A year ago, she was 14 years into the path of becoming diabetic. And then next year, she crossed some magical threshold created by the FDA to say, well, yesterday you're not diabetic and today you are. Yesterday you have no risk, but today you're a massive risk that requires 3 classes of drugs: a diabetic pill, a blood pressure pill, and a statin. And who even knows that the doctor prescribed an adequate dosing or treatment for any of these problems?
Forget about the FDA. There's nothing we can do about the government and the FDA. But the knight
Well,
in
but
shining
the FDA
armor,
is
the
guiding
knight in
people
shining
about what
armor
to
is the
do.
doctor. No, they're guiding the doctors. We have no control over what the average person doesn't know anything
we're
about the
telling
FDA.
the listeners that if your doctor is employed by a system, then that system is following the rules established by the FDA and the insurance companies. And that means that if that's who you're getting your health care from, you are not getting the information you need to stop these events from happening. And they can be stopped. In fact, they are all possible to be stopped. In my world, no one needs to have a heart attack or stroke. And if you work hard enough, a lot of other chronic diseases can be stopped or delayed, well into your older years.
Well, the point is that with the technology in this country, we've had certain of these diagnostic tests have been out for 20 years, albeit they're still not covered by insurance. Even although the first test, the CT cardiac scoring test, is $125. The CIMT test has to be paid out of pocket. And so there might be a half a dozen different tests that basically cost a couple $100. They're not covered by insurance. So therefore, every doctor should know about what tests are out there. The technology is out there and give you a choice. As a patient, you're a consumer, you have a right to know what test is out there that I can diagnose or prevent a disease, and then give me the choice of whether or not I want to pay for it. And these doctors are not doing that.
So in our final minute or so, the most important test to me is this simple ultrasound we do in our office. It's called a CIMT, carotid intima media thickness test, and it provides information. Number 1, do you have plaque? And number 2, if you have plaque, what is the data that measures risk? And that data point can be followed over time. You can repeat that ultrasound once a year, every 18 months, to measure the progress of your efforts to prevent chronic disease. And that data point correlates very well with risk. There's lab work to accompany these data points that we measure. And while we're doing that, we look for other drivers of disease. Siobhan mentioned somewhere on Facebook that she's screening for sleep apnea. We're looking for genetic predisposition to disease. We look at gut health. We look at oral health, which is another unrecognized area that can contribute to your overall body's health. But it starts with disease identification. It doesn't start with, do I have diabetes? No, it starts with, do I have plaque? And you can start checking that at age 30. You don't have to wait or hear anything. You want to identify disease. And before I go, happy holidays. And everyone have a safe Christmas and New Year's and Hanukkah.
Be well over the holiday period. Absolutely. Well, unfortunately, we're out of time, so I'd quickly like to thank Dr. Brian Kolender, MD, specialist in prevention, for being here tonight and for being willing to share his expertise and knowledge with regards to not only the prevention of disease, but also on the importance of being proactive and engaging with a practice that provides access to the necessary testing. If your doctor doesn't send you his way, call 866 Kolender and sign up for this very important testing and screening. This show is brought to you by Kolender Medical. I'm your host, AnnMarie Cronin. We hope you got some useful information tonight on how to be your own advocate and take charge of your health, whatever your medical journey. Thanks also to my co-host, Siobhan Cronin. Please continue to tune into our shows Sunday afternoon at 3, Thursday evening at 7 for the latest medical updates. And thanks for listening to 760 WJR. Good night and be well.
Opinions heard in the preceding program are those of the host and guests and not those of Cumulus Media or
Yes.
Thank you.
Takes her headphones out with such a vengeance.
What did she say? What? What'd you say, Siobhan?
I said you take your headphones out with such a vengeance. You're like, yes.